Namaste and good afternoon. How have you all been? This is Dr. Srinidhi Chidambaram, and I'm very happy to welcome you to this special Facebook Live session presented by Apollo Hospitals on World Parkinson's Day. World Parkinson's Day, which is held annually on the 11th of April, is an incredible opportunity for people with Parkinson's disease, scientists, supporters, fundraisers, families, carers, and clinicians to come together. You all must be familiar with the term Parkinson's disease. But what is it? It is a progressive neurological condition. It's something which is a neurodegenerative disorder, which means it kind of causes slow and steady deterioration of neurological functions, affecting prominently the dopamine producing neurons in a specific area of the brain. Symptoms slowly develop over years, and it kind of varies. And the physical symptoms, like there might be tremors of a particular type, which our doctor will now explain to us. There might be slowness of movement, spasticity, gait problems initially, but later on it can cause problems with the cognitive function, forgetfulness, trouble with concentration, and might even progress into dementia and memory loss. So, the first step to accepting the diagnosis of Parkinson's and living well with it is to understand the disease and its progression. It is very possible to have a good quality of life with Parkinson's by working closely with your doctor and following the recommended therapies, which are very essential in treating the symptoms. So, today we are going to discuss all about Parkinson's and also about specifically the thinking and memory problems in Parkinson's. And for this, I'm honored and delighted to welcome Dr. Sudheer Kumar Tyagi. Dr. Sudheer Kumar Tyagi is a consultant neurosurgeon at Apollo Hospitals, New Delhi. He studied his MBBS from the prestigious King George Medical College and then his MS and MCH from AIMS. He has more than 32 years of experience and has done more than 10,000 neurological procedures. Uh, for his services, he was awarded the Vishisht Chikitsa Ratan Award by the Delhi Medical Association in 2015. And he has numerous research and publications to his credit, a written chapter on functional stereotactic neurosurgery in the textbook of operative neurosurgery. He is a member of the Neurological Society of India, the Delhi Neurological Association, and also a member of Association of Functional and Stereotactic Neurosurgery and the Association of Spinal Surgeons of India. Dr. Tyagi, thank you so much for joining us and welcome to this session. Uh, we look forward to hearing your valuable views on Parkinson's disease and the thinking and memory problems. Over to you.
The Parkinson's disease is basically a movement disorder in which the quantity of life is not at the stake, but the quality of life is very much at the stake. Parkinson's disease is basically idiopathic, degenerative, progressive disorder of the movements of the body. Each word has its meaning. Idiopathic means we don't know the exact etiology, what does it cause, because of what it is happening, nobody knows, so that's why it's called idiopathic. Degenerative, because the neuronal cells, the nerve cells are getting degenerated in particular part of the brain, which we call substantia nigra. That's why it is called degenerative disorder. And progressive, because it keep on progressing with time. That is why disease is called progressive. So idiopathic degenerative progressive disorder of the movements, in which a particular neurochemicals in the brain get depleted, which is secreted by the neurons, the nerve cells from the substantia nigra. Thus, this neurochemical is known dopamine. The deficiency of this neurochemical causes leads to all kind of the movement disorder symptoms, which include the slowness of the movements, tremors, rigidity, akinesia, and other associated symptoms.
So, though it is idiopathic, Are there any risk factors, as in, are there any probable causes why some people should get affected by Parkinson's?
So research has doesn't prove anything. The risk factors are there, but some research has shown that it can come in the families sometimes. So some genetic link may be there, but still it is not proven. But there are some families in which the Parkinson has happened to the grandfather, father, and the grandson.
Are there any other like causes, as in, like, some kind of an accident or a head injury? Do those kind of things trigger this sort of Parkinson?
Repeated traumas to the brain are known to cause movement disorders and some kind of Parkinson's disorder, but it is very difficult to prove and link it
Link
by
them.
this.
So, what would be the earliest symptoms of Parkinson's? So, how does one recognize that it might be and uh, take medical help and so on?
Yeah. Different people present in a different ways. The earliest symptoms may be the slowness in the walking. They usually people see in their family somebody has started walking very slowly. So slowness of the walking, the slowness of the other movements are the earliest symptoms. But some patients develop tremors in the early stage. So we have two types of the presentation. The slowness of the movement may be the earliest symptom, and in some cases it may be the resting tremor, where the patient is sitting at the rest, and there are some different type of the movements in the that we call, particularly call it pin rolling tremors. They are moving like this. So these tremors are usually the first symptoms.
So, are there any more characteristic symptoms that point towards Parkinson's?
Yeah, there is a particular triad of the symptom which tells us that person is having Parkinson's disease. The triad of symptoms includes the tremors at the rest, especially the pin rolling tremors at the rest. Second is the rigidity. Whenever a patient is working, his movements are very rigid. His body is very rigid. And third is akinesia. When he tries to do something, he moves very, very slowly. So these are the three symptoms. They are the cardinal symptoms of the Parkinson's disease.
So, if somebody notices these kind of symptoms, what should be the next steps?
No, pardon me. What is your question?
No, I was saying that, once these kind of symptoms are noticed by someone, what would be the next steps that they need to take medically?
Yeah. See, if the somebody notice these symptoms, the best thing to do, take the patient to the his physician, your usual physician. Why I am saying this? Because your physician knows you completely.
Yeah.
The general practitioner who see you every day, your family physician, he is the best person to diagnose what kind of changes are happening in your body because he sees you regularly. So go to your physician and get yourself checked up. And if he feels that the symptoms are going towards the movement disorder like Parkinson's disease, he should definitely going to refer you to the neurophysician. And the neurophysician is the main person who treats the Parkinson's disease and they diagnose it well, perfectly, and he is the right person to treat the Parkinson's disease with the medical treatment.
So, how is Parkinson's disease diagnosed?
Yes, the diagnosis of Parkinson's disease is mainly clinical. Because if you see these symptoms and if you see these symptoms are progressing and there is no other disease, your MRI is normal, brain is normal, but your symptoms, movement disorder have these three cardinal symptoms, the tremors, rigidity and akinesia. So definitely this is the Parkinson's disease. The main is clinical diagnosis.
Are there any other diagnostic tests, or it is just purely clinical only?
No, mainly it is clinical.
Are there any lifestyle factors that may, I mean, I know you said that there's no direct link established, but is it like, obese people or someone who has a long history of smoking, or are those kind of people more prone to Parkinson's? And is there a gender difference in the demographics?
See, all these things are negative factors for the brain. whether you take obesity, whether you take the this smoking and alcoholic, all these things have negative factors on the brain and cause the early degeneration of the neurons. But there is no direct link to the Parkinson disease of these problems.
So you were saying that this is mostly the tremors are very characteristic of Parkinson's. So are they only the pill rolling type, or are there other kind of tremors that can happen? Any other movement issues?
Yeah, tremors may be of different types in the Parkinson disease, but the classical is the pin rolling tremors. But other than some people have very disabling, the whole extremity moves. But it is mainly on the rest. And the character is when you try to do something, you try to hold something, the tremor will stop. So when you are doing some action, the tremor will stop. When you are at the rest, the tremor will come back.
And is it a disease of the elderly, or does it also affect younger people?
Largely, this is the disease of the elderly, but the juvenile Parkinson also we see, in which the patient start the Parkinson disease in a very early age. So the juvenile Parkinson are also there, patients are also there, but largely it is in the elderly.
Right. So now I think we will come to a little bit about the pathophysiology of Parkinson's. You said that it does affect the dopamine producing cells. So does it specifically, what is the effect of this dopamine in the body? And how does it kind of degenerate, or what are some of the mechanisms that go on inside the brain in Parkinson's?
See, the neurons secrete different neurochemicals. And the one particular area is substantia nigra in the deep part of the brain, which is in the subthalamic area, where there are the neurons which secrete the dopamine. This is a particular neurochemical which coordinate our movements. And if the dopamine is not getting secreted properly, our movements will become haphazard and we'll get this kind of symptom like rigidity, tremors, and the slowness in the movements. So this is basically this neurochemical which gets depleted in the brain, and that's the reason we get these symptoms.
Now I think we'll talk a little bit about the treatment of Parkinson's. So what are the different modalities of treatment, doctor?
Yeah. See, the treatment of Parkinson is mainly medical. Like we have certain drugs which really gives very good effect in the Parkinson's disease, like L-Dopa and amantadine, and other are like Sinamed. All these medicines are basically either agonist for the dopamine. The dopamine which get depleted is basically we are replacing that dopamine by these drugs. And one of the best drugs is L-Dopa. And another is the anticholinergic drugs like amantadine. This also helps in coordinating the symptoms in a better way in the Parkinson's disease. So main treatment remains medical, but with medical treatment, the disease keep on progressing. The symptoms get better, but disease inside the brain keep on getting progressive. So this is the
So,
problem.
are there any surgical treatments for Parkinson's?
Yeah, that's what I said, because the disease is progressing and the doses of the medicines or keep on increasing with the age as the disease progress. So there are patients who stop responding to the medical treatment, or they can start having side effects of the medical treatment. The main side effect of the medical treatment is dyskinesias, and this becomes very disabling for the patient. They are not able to do anything. They are not able to take the medicines after the certain dose. So they become very uncomfortable with the medicine. So these are the patients with the referral of the neurophysician come to the neurosurgeon. The neurophysician is the right person who decide who is the right patient to go for the surgical treatment. So there is surgical treatment, but the selection of patient is equally important. Patient should have been treated well before the going for the surgery. Medically should have been treated completely
Should have been
for a
explored.
long period of time by the neurophysician. So we have the surgery for this.
Okay. Is this what they call the deep brain stimulation surgery, or can you explain a little bit about the surgical?
Yeah, there are two types of surgeries. One is ablative surgery, in which we certain part of brain we do thermocoagulation, we destroy that part, and we get the desired response in the movements. Like we call it pseudo-palidotomy and thalamotomy, depending on the way which area we are going to thermocoagulation, we are destroying which small part of the brain. Another is deep brain stimulation. In deep brain stimulation, we do not destroy any part of the brain. What we do, we put a microelectrode inside the subthalamic area. There is a particular nucleus, which is a group of neurons. And in that, the microelectrode has been stimulated from outside, which is by the wire it is connected to the battery, which will lie in the subclavicular region, subcutaneously. Everything remains inside. And this gives the desired stimulation to that particular group of the neurons. And it gives the very good effect on the tremors, rigidity, and akinesia, on all three things. So this is called deep brain stimulation. Deep because it is in the very deep part of the brain, and stimulation because we are giving the controlled stimulation to those neurons.
Doctor, can I request you to talk a little more loudly?
Yeah.
Yeah. Now we will talk a little bit about another entity which we keep hearing called drug-induced Parkinsonism. So, what is that? I mean, and what are the drugs that induce it?
That is, certain drug abuse causes Parkinson's disease, and there are certain drugs which we use for the another treatment for another diseases, but they have a side effect. People develop movement disorders. They develop dystonia, sometimes they develop tremor, sometimes they develop rigidity. And these are the patients in which the first thing is to withdraw the medicine. Second is the medical treatment. Surgical treatment is not very helpful in the drug-induced Parkinson's.
Now we will come to the actual part of the topic today, which is about the psychological, the memory, and other cognitive disturbances that happen. So, do these happen early on in the disease, and does everybody who has Parkinson's develop symptoms like dementia or memory loss?
In pure Parkinson's disease, the cognitive disorders are usually not there. But there is a term called Parkinson plus, in which along with Parkinson's disease, there are other cognitive dysfunction comes. People get depression, people get memory loss, and along with this, they develop the bladder and bowel symptoms. They are not able to know when they have to pass urine. The urine will get passed on its own. So these are the problems which are associated with the over the Parkinson disease, and these patients are called Parkinson plus patients.
So, is there any, can we predict that such who will develop that and who will not, or is it just by?
Initially, in the pure Parkinson's disease, we see very less patient having these kind of symptoms, but definitely depression comes over a period of time because the quality of life suffers. Because of that, they develop some psychological problems. They are not able to perform the way they were used to perform in their life. So because of that, depression definitely gets there because of the poor quality of life. But other memory loss and the speech problems, they come when the patient is having other part of the brain is getting affected because of the some microvascular changes in the brain, and that these patients are called Parkinson plus patients. They are not pure Parkinson patients.
Does it also cause disorderly thinking and behavioral issues?
Yeah, definitely. Parkinson plus definitely have behavioral issues, but because of the depression, the people get frustrated with the long disease because it is not a curable disease after all. We have to just control with the medicine and the surgery, and because of the long duration of the disease, the behavior keep on changing with time.
Do they also develop mental confusion and hallucinations and those kind of things, or is it only part of the Parkinson's plus?
This is the part of the Parkinson plus. Pure Parkinson patients usually have only movement-related disorders.
Movement-related disorders. One keeps also, like, there is a lot of information available in the internet that we use other therapies like, physiotherapy, and then there is massage therapy, or even alternative medicines like acupuncture or hypnosis. So, what is the role of all of these kind of alternative and complementary medicine in treating Parkinson's?
I think that active life and physiotherapy definitely has a positive role. They definitely help the patient to get better. So with the medicine or with the surgery, if we are doing the good physiotherapy and patient is active also, this have very positive effect on the overall outcome. The patient feel better and they definitely do better than other patients who are not doing active physiotherapy. As far as other alternative medicine concerned, I think I'm not the right person to talk about it because I have no experience of this. So, and it is not proven by any research also. But physiotherapy definitely and being active is definitely helpful.
So, what kind of exercise will a person with Parkinson's be advised to do? Because obviously they will have problems in movement as well. So, what would be the advice given to them?
I think daily walk is one of the best thing. Morning, evening walk is one of the best thing that gets the movement coordinated and patient get the rigidity also improves with that and akinesia also improves. So daily walking is one of the best exercise for these patients.
And what would you advise the family of somebody who has Parkinson's? What should their approach be towards the patient?
My advice is whenever they see any change in the movements of the patient or any slowness in the movements, they should go to the family physician. And if he advise that it looks like Parkinson's disease, they should definitely go to the neurophysician and they should start their treatment. And the dose of the medicine should not be very high initially because the medicine itself causes progress in the disease. So those should be very well calculated and can be done by a neurophysician only. There should not be any self-treatment, which is not advisable. It should be totally under the neurophysician. And whenever the neurophysician feels the medicines are not working well or they are giving side effects like dyskinesias, then they should refer the patient to the neurosurgeon for deep brain stimulation surgery, which is the good surgery and having good outcome at present without destroying any part of the brain.
Are there any new drugs or any new treatments which are there in the horizon, like in research or upcoming any modality which is going to cause a lot of change in the outcomes for Parkinson's?
There are definitely there are claims about certain medicines, but still there has to be proven by the research and to come to get the FDA approval before we really tell the people they use these drugs.
So thank you, Dr. Tyagi, for this wonderful discussion. I think we were able to give us in a nutshell all aspects of Parkinson's disease. And thank you, dear viewers, for viewing this session. And I do hope it was useful to you to learn all about Parkinson's. Do reach out to us for any queries which you may have. You know, we are there on all the social media channels, and we were always there to respond to any assistance that you may need. Receiving a Parkinson's disease diagnosis can be very overwhelming for both the patient and for the family. The news can leave you unsure of what to do next as you begin to process your emotions. And the main thing is that it's important to know that you're not alone. We are here for you at every stage of your journey, and you can begin to build a better life, a better quality of life, even if you have been diagnosed with Parkinson's disease. Just seek help and take proper medical advice. So, till we meet again, stay safe and healthy. Thank you and namaste.